There's no need to be perfect to inspire others. Let others get inspired by how you deal with your imperfections. Hi viewers, it's your girl Olori, and I'm here on the hot seat again with Dr. Adesoya, a renowned gynecologist, an obstetrician, a promoter of good living and perfect health. Hello, Dr. Adesoya.
Hi, Olori.
You're welcome.
It's always a pleasure to be in your midst.
Thank you very much, sir. Okay, so as usual, we are here with the back-to-back questions about women, mostly women.
Bring it on.
So today we'll be talking about antenatal care / delivery.
Wow. Okay.
Okay, so Dr. Adesoya, what is antenatal care?
Okay.
When you say antenatal care, what do you mean? Or do we have other terms? Or do we have other phrases? Or do we have other words that we use? Or antenatal is antenatal.
It's the specialized form of care you give a woman while pregnant in order to optimize the health of the mother and the baby so as to have a healthy baby giving birth to a healthy mother at the end of the day.
Okay.
So that's what antenatal care is all about.
Okay. Thank you very much. So when and how do we start or begin antenatal? A pregnant woman. Is it once she finds out that she's pregnant immediately? Because I know some people find out maybe 2 weeks, a month, but as soon as you find out about the pregnancy, should you register? Or we have a certain age of the fetus, maybe 2 weeks, 3 weeks, 1 month. Kindly.
Okay, that's a very good question. I think it affords me the opportunity to talk about this, to have a straight answer. I would say after the second missed period.
Missed period. So missed period should be like second month?
Yes. So you miss your period now.
Right.
You know the date you're expecting your period. You have missed your period. So you expect it for so long that, okay, you have missed the second month.
Right.
So putting it in figure, we say 8 weeks. Because by then, the ultrasound scan is supposed to have been able to establish the viability of the pregnancy.
Okay.
You don't go and register for antenatal when you are not sure if the pregnancy is viable, if it's what we call blighted ovum, if it's what we call an embryonic gestation, where the pregnancy will not continue. So you don't go and register for antenatal. So once the viability is established, you are good to go and register for antenatal.
Okay. So thank you very much, Dr. Adesoya. I understand when after registering for the antenatal, you begin with some medications. I'm still coming back to that. So when again, I need to talk about the pelvic scan. Is it a pelvic scan or abdominal scan that should be performed? Again, that is one. Again, how often during the 9 months or the 3 term during the pregnancy, how often should the pelvic scan be performed?
Okay, that's a good question. First and foremost, when you are pregnant and the pregnancy is still below 12 weeks, whatever scan you are doing is pelvic scan. The womb is still a pelvic organ.
Okay.
So we call it pelvic scan. So there is no abdominal scan in all of this.
Right.
So
what you're saying is during pregnancy, like during the 9-month pregnancy, it's all through pelvic?
No.
Okay.
Now listen.
Just to clarify.
So now, when you are below 12 weeks, around 8 weeks, 9 weeks, 6 weeks, 7 weeks, 8 weeks, 9 weeks, 10 weeks, it is still a pelvic organ.
Right.
So whatever scan you are doing to look at the womb, to look at the gestational sac, to look at the baby is pelvic scan. The moment you get 12 weeks and above, it becomes an obstetric scan, not abdominal scan.
Okay.
An obstetric scan because the baby at that time is
growing,
fully formed and growing, adding flesh, growing, in size and the number of cells. So at that point, it's obstetric scan. Now, how often are you supposed to do it? So there are 3 most important time you are supposed to do ultrasound scan. I know it's a common practice in our environment that people just go, I want to do a scan, Some people even, believe that it's a scan that actually
I'm
help
guilty of
them.
that. I think my very first pregnancy, I think I performed more than 10 scan. I was obsessed with it.
So now
You're right.
the three most important, even some will tell you two, but if you take it to three, it's still okay. That is when everything is going smooth. The first one is the one that will locate the gestational sac. That is inside the womb. It helps you to date, to know the age of the gestation. It also helps you to determine, is this pregnancy viable? Is this pregnancy, is there cardiac activity? Is the baby ready to grow? So that's the first scan in the first trimester, which I mean, the earlier it is, the better it is in terms of dating the pregnancy. Now, the second one when is what we call anomalous scan or anatomy scan. It helps us, around 18 weeks, 19 weeks, 20 weeks, 21 weeks. That one helps to evaluate, to check the baby, even while growing. Is there any problem in any part of this baby? Is there any congenital malformation, any defect,
I
anatomical
think that is
defect?
very important.
So that is what we call anomalous scan or, anatomy scan. So that's the second scan. Now, some will tell you that, okay, any other thing can be detected by your doctor's examination, except there are conditions that warrant extra investigation. There are other tests that you can do to monitor the baby, to check the mother while the pregnancy, when you, are doing antenatal. But the most important are the first two. Then the third one is around 36 weeks, when you want to now determine, you want to plan birth, preparing for delivery. Okay, what's the size of the baby, average size? Because baby is already fully grown and you want to weigh in. Okay, is this baby big? Is this baby small? Is this baby,
Okay, so that besides, sorry to cut you short. That reminds me. I'm so sorry, my viewers. It's just my thought process, so I don't forget while we're talking. I understand there's this particular term that they use for when the fetus is when maybe the head is bigger than the leg, or the leg is bigger than the head. It's not asymmetrical something. Something.
Okay.
So can you clarify that as well? Because I know that is also.
So that may be a reason, or that may suggest a need for frequent scan or other even more sophisticated investigation.
Right.
Are you getting it?
Like, so what is it called? What is that?
Okay, we are talking about intrauterine growth restriction.
Right.
When the baby is not growing at the rate that is expected for the age of that baby. Now, okay, you know that this baby is 30 weeks, you expect 30 weeks. There's a graph that we usually plot to assess. So when you see any disparity, you want to check again. Then you want to check again. Then you want to, okay, is there a growth? Okay, then is there anything going on, any insult affecting this baby? You want to investigate. That's taking into it. See, this is one of the reasons we do antenatal care. I don't know if you have it as a question. You should be wondering, why do we all have to queue up in numbers to go and visit a doctor because we are pregnant? I used to tell people, if you pack 100 women who are pregnant in a room, and you leave all of them eating, enjoying themselves, fall in labor, deliver, over 70 of them we take the pregnancy to term, deliver, and nothing will happen to them.
I'm coming to that too.
But you see that 30 or less, those are the reasons we screen. That's why we call it screening at times. You look out for those problems so that you can, because when you are pregnant, any problem that shows face, if you don't address it, it can take life of not only one, but now two lives. So we take it seriously.
Yes.
And lo and behold, at times you don't know. Yes, we have some risk factors that we use to look out and say, okay, you're high risk you are low risk. Lo and behold, even among the low risk, problems can arise while the pregnancy is going on. So we must be on our toes. We must be alert. We must carry the woman along. We must communicate in terms of what she's feeling. We must examine. We must check what is going on to know that, okay, everything is going smoothly. Everything is going smoothly. See, these are some of the reasons why we see some people just open shop by the roadside and they will be telling you, that woman delivered in my shop. That woman delivered. Because there are some that will go and actually deliver if nobody touches them. So those are the ones they will be ascribing their success.
Right. That's a lucky one.
Now, the lucky ones. So now, when there is a problem showing face, do you now have the skills? Do you have the knowledge? Do you have the ability
to begin to refer
to identify those things so that you can do the right thing? That is the reason. That is the main reason for antenatal. Because at times it's difficult to predict from the beginning of the pregnancy. I don't know if I deflected.
No. I think this. I mean, I take this particular topic very, very personal because it's very unfair. I mean, I would implore the viewers. It's very unfair to we women. I mean, ladies, women, mothers, especially those that are pregnant at the moment. It's very unfair for us to. I mean, after some of us, I've been trying to get pregnant for a while, and then we don't get pregnant, and then we get careless, and then we go all through the stress of pregnancy and all of that for 9 months, and then at the end of 9 months we have a child that is healed or abnormal, or as the case may be. That is very unfair. So I would implore our viewers to please kindly listen to all of what we are saying here. Please, it's very important. Let's just do that for ourselves, please.
Absolutely.
Okay, so having said that, what habits do you think we should incur or stop or not do during pregnancy?
During pregnancy.
Okay. I mean, what to eat, lifestyle, exercise. I'm packing everything together right now. So you can just take it one by one.
So yes. Taking it one by one.
Yeah.
Actually, it's the most important part of antenatal. It's actually the lifestyle, it's the habit. Because if you look at it, some people will say, we've just been going to the clinic. They are just giving us some tiny drugs. You may not require so much drugs, but what do you do? How do you manage the physiological changes? How well informed are you to know what you're expecting when you're pregnant? Is your man ready to be woken up 1 a.m. in the middle of the night that you want to eat puff in Ibadan sky eye or Amala sky eye? That okay, that's the only thing I want to eat now. Cravings. Is your man ready? Is your man ready to even understand the physical changes that come with the pregnancy? What we call skin and changes that come with the pregnancy. Are you getting it? So when you are, one of the advantages is the information, and information is power. The information, knowledge is power. So now, what do you avoid? Let's start from, there are so many stuffs on the island. Don't eat pineapple, don't eat snail, don't say. You are depriving yourself of quality.
Those are meat.
Quality meal. The things you need to avoid is try avoid taking alcohol.
Right.
I cannot go on and on the possible complications that might arise when you are a binge drinker and you are pregnant. Fetal alcohol syndrome. Since some of us like Google, you can Google around it and read about it. I can go on because it comes with a lot of deformities, a lot of fasci, a lot of intra-uterine growth restriction and abnormalities. And you don't want that, just like you said. Carry a pregnancy after 9 months and coming down with such things. So you don't want that. Then also take smoking. Smoking. What is inside the content of smoking can cause some issues, especially in third trimester, which you don't want, some complication. Then caffeine. They will tell you reduce caffeine. I can't
like
go
if you mean coffee?
I can't go out in the morning without
having coffee.
There are a lot of energy drinks now that contain caffeine.
Yeah.
So you should avoid any caffeinated
Drink.
drinks or coffee, well, is it outright avoidance or cutting down? If you don't have a means of measuring what you can take or the content of the cafe, just do away with it. It's just
I think you should avoid sex as well, so that it doesn't punch the baby out of the stomach too, the fetus.
I don't know about that.
So please kindly enlighten. What's the best sex position? Because I know a lot of our men, when their wives are pregnant, they avoid them, and that's the common knowledge of these our men. That I don't want to touch when she's pregnant, so that I don't touch the edge.
So
Or
we can't totally blame the guys
Is
for
it true?
avoiding, but it's for them to know now that you don't need to avoid. You just need to be gentle with your partner.
Right.
Now, sex is not contraindicated in the first trimester, second or third trimester, but in the first and third trimester, you need to be a bit careful. You need to be more gentle. However, there are conditions in pregnancy that you will be told to avoid sex. Let me just mention one in the first trimester. If your wife has issues with recurrent early trimester loss, if your wife is having what we call cervical incontinence that necessitates the use of what we call saccharide, something that we use to tighten the cervix so the pregnancy is not going to come out. You want to avoid sex after that procedure, for several reasons. Then also, if your wife has what we call placenta previa, when the placenta is covering the place the baby is going to pass. So anything can trigger bleeding when you come in through the private part. So you want to avoid sex in this condition. There are a few others, but generally, low risk pregnancy, you can have gentle.
So let me take you back to where I interrupted you. So you're talking about alcohol. We're talking about smoking.
So no two ways about it.
Right.
Cut down the alcohol or stop it outrightly. Cut down smoking, stop it outrightly. Cut down caffeine, cut it outrightly. And this is the period you want to be very careful with your meats. You want to ensure your meats are properly cooked because of the fear of what we call toxoplasmosis. These things are usually found in poorly cooked meat or raw meat. So if it's poorly cooked, if someone is infected with that organism, the baby is affected neurologically and some other congenital malformation. You don't want that for that length of time when you're pregnant. You don't want that. So you avoid that. Then also unpasteurized milk, all this cheese, and I think in this they call it wara. So if it's not properly treated, cooked, you avoid it because that one also there's what we call listeriosis that can also lead to some complication in the baby. So you want to avoid it. Apart from this, don't eat pineapple, don't eat pawpaw. All those ones are just
actually very essential
or necessary meats that is being thrown out there in social media. You need to eat lots of fruits and vegetables. You need to double up on how much of water you take. If you listen or if you watch my video on the 13 lifestyle acts, everything on lifestyle acts that you're supposed to do is what you're supposed to still do in your pregnancy. Exercise, take a walk. You don't want to do heavy duty exercise. You don't want to lift heavy objects, but you want to take a walk. You want to do some breathing exercise.
Light exercise,
breathing exercise. Now, let me also explain breathing exercise. In my clinic, I've seen a lot of misconception about breathing exercise. Breathing exercise is not useful when you are doing the exercise. It's largely useful or more useful when you are in labor.
Right.
It is generally known that when you are in labor, it can be painful. Even when there is what we call pain management, which is expected in labor, you can still have pain, and the attitude of individuals differ. Some people scream when you are in labor, shout because of the pain, understandably so. However, when you are in pain, when you are shouting, you are losing energy.
Yeah, it's true.
Because you use a lot of ATPs. The science students will understand what I'm saying. You use a lot of ATPs when you are shouting, screaming. So now that's where the breathing exercise comes in. When you are used to hyperventilating. That's what we call breathing exercise. You're breathing out heavily. So when you're now in labor, you're in pain. Rather than at the peak of your contraction, rather than screaming, you're now doing that. In exchange for losing energy, you are gaining energy. Are you listening? It's not very easy. That's
not
why
so easy.
That's why
we don't even remember that.
So that's why the exercise is necessary. Because when you are doing the exercise, you bring it to your consciousness or maybe subconsciousness, the case may be. So when you are in labor, when it's needed, you make use of it. That's a form of exercise too. So those are the things you do.
Okay, so going forward, I'd like us to talk about medications.
Okay.
Because I know some women, some pregnant women don't even take medications. They just if I struggle, I'll be fine. God that put the pregnancy there would protect it. And so how important is it for a pregnant woman to take her medication?
So now, when you say medication,
I know antenatal medication.
Yes, I want to address this differently. Okay. You can look at medication in terms of a low-risk pregnancy, everything is going smoothly, everything is fine. You can look at it from a pregnancy that is high risk. Maybe there are some medical conditions even before getting pregnant, or there are some conditions that develop as a result of pregnancy.
So what we're talking right now is antenatal medication.
Yes. Okay. Now, we don't need to even emphasize that. Once your doctor have evaluated you, they evaluate you and you have been
ascertained.
Told that you need to take this medication. Now, we don't need to make noise about the need to actually take the medication.
There is actually.
Now, so medication can either be because of your pregnancy, which is highly necessary. Because look at it, most times the drug we give are iron-based because of the blood. Why do you need iron? My body, I'm okay. There's nothing wrong with me. Yes, you are okay, but a guest is joining you,
right?
That will also build his or her own blood.
It will start sharing your nutrients.
Now that baby is going to extract a lot from you. 1, 2. The placenta is an organ on its own, and it's also going to take a lot from you. There is no human being that has given birth before without some bleeding. That's some amount of blood, iron, and all of those proteins being lost there. So, in anticipation of all of this, we need to fortify our system. To fortify our system to be prepared for those minor losses here and there, so that after the delivery we are still strong and ill and healthy. However, when you are in the first trimester, it is advised that you should be properly evaluated to know what you need. It's a common practice in our environment. We practice what we call polypharmacy. People believe, if it's not expensive, it's not original. So I must use this. Okay, let me use, I won't mention any name of any drug, but I will use their code. There's what we call iron folic acid, IFA. It's a code, iron folic acid. Then there is MMS, multiple micronutrient supplements.
Okay.
So the multiple micronutrient supplement comes like one capsule. While the tablet. While the other one comes like, you have folic acid, tiny, then ferrous of it. Some people may need one morning, afternoon, night, some one a day. Now, some feel because this one is more cheap, let me combine it with it. They told me this one will make my baby do this. When you are taking, I want to state categorically, when you are taking IFA, when you are taking either iron with folic acid, you don't need any medicine, except that maybe you have iron deficiency. Even if you have that iron deficiency anemia, the doctor will evaluate you and tell you what you need to optimize your blood. So combining them is polypharmacy, and it only make some of the physiological changes worse. That's why some people are constipated. That's why some people are, can give you some other challenges. So also in first trimester, if you don't have iron deficiency, it's even advised that just take your folic acid in the first trimester to avoid iron. Then in your second trimester, even if everything is fine, you can now join with that. And again, in addition, a lot of people think every pregnant woman must take calcium. You don't take calcium with some of these things because calcium has a chelating effect on iron. It reduces the number of iron you get from the drugs you are taking. So some of these things, you follow the doctor, follow the prescription, don't follow anti this, anti that, well. So I won't speak anything against it.
I try so much not to mention that.
They are well regulated.
Right.
So as you have quacks among the doctors, you have quacks among the TBAs too. But you can't completely. They are working very well in conjunction with the health practitioners now, those that are regulated. And if you are very observant, our maternal mortality in Lagos and in Nigeria as a whole has dropped significantly. And I think it's all out of the cohesion, coordination between the trying to train them, let them know the limit, the basic thing, letting them know.
Right thing.
But however, I think it's still better when you get your best advice from
medical practitioners. Okay, thank you very much for the clarification, Dr. Desoya. Thank you so much. So going forward, when should a pregnant woman begin to talk about delivery options?
So that's part of the protocol of antenatal care. At 36 weeks, there's what we call birth preparedness, complication readiness. This is the time you now determine, this is where I want to have my baby. This is how I want to have my baby. This is who should take my delivery. This is what I want during my delivery. Am I taking this? Am I not taking it? Is my husband going to be? Is my relative? All those.
Who is going to be with me? How many people is going to be with me?
Birth preparedness. Because at 36 weeks, in another 1 week, your baby is ready to come out. And even from 36 weeks, anything can happen. Labor can begin. So you have to be fully equipped with information that, okay, I'm entering a very, very important phase. And this is the time also, the uterus also does its own exercise. A lot of people, it's bacteria is contraction. It's like the womb trying to exercise, getting ready for the D-Day. The D-Day is the labor. So you will have some tightening, and there are things that come with that period that is telling you, okay, now start getting ready. That's very prepared. Complication readiness, because in obstetrics, every incident, every issue is always like an emergency. Because if you sleep, God forbid, baby can go. If you don't make move on time, God forbid, baby can go, mother can go. Which is why everybody is screaming, why we are fighting, why Lagos State is doing it. Nigeria, organizations were speaking, we're talking about it. Are you getting it? So you don't want to sleep. So complication readiness includes who is going to take you to the clinic when labor begins, when you start seeing the signs. The car is ready. Your delivery materials are they well arranged and organized? If possible, put them inside your car.
Their Romo? Their Romo.
Get them ready-made in your car.
Right.
And if you are not using car, if you are hiring, have an arrangement.
I mean, some women have their Romo in their car, like from the 5th month.
And so those one are trying to be proactive.
Yes.
It's not a crime, but once you're 36 years, you must, because we don't want the baby to come out even 5 months.
Right.
We don't want it.
I know.
So put it there. Well,
it's just in anticipation. Yes. Especially first timers.
So if you are using, if you are hiring, then you must have an arrangement with the person. If you want to pay upfront, fine.
I can
if
call
you want to,
emergency, anything.
it can be 1 a.m., it can be 2 a.m., it can be 3 a.m.
Outright.
Because there are some conditions that once they show face,
you have to move.
You have 4 to 18 minutes.
You have to move.
You are saying, I'm waiting for
my honey,
And where is he? He has gone to work. He's not back yet. Until he comes back, you don't wait for anybody. That's why you must be prepared. You would have discussed. If I'm busy, let Joseph pick you immediately and take you to the hospital so that you can have a healthy baby. I mean, and still remain healthy.
Thank you very much, Dr.
So,
Adesanya.
36 weeks. I don't know that.
Okay, that's fine. Because I think we already jumped right into delivery because that was supposed to be like a soft topic. So the next question I would like to ask is, I would want to talk about is the vagina delivery and the C-section.
Okay.
Can you just quickly, in minutes, just tell us the difference?
So, the difference.
The difference.
Well,
we all know the difference,
okay.
But just tell us.
Okay, so
talk about it.
So, vaginal delivery is simply having your baby via the birth canal. The natural pathway, the birth canal, private part of the woman. So, now the cesarean section is when you have to deliver the baby through an incision made on the abdominal wall of the woman before you get to the uterus. Make an incision on the uterus and bring the baby out of the womb and repair everything back. So now, if there is a part in the birth canal, what will inform the need to go via the abdomen through a surgical procedure? There are reasons for it. And reason is, I need to emphasize this, it's not only because the baby cannot pass the place. I'm stating this because at times you see some people say, okay, this baby, the doctor has said you need a cesarean section.
Sorry, let me put a question to what you're just about to say. Let me put a question to it. At what point will the doctor say, okay, you need a C-section? Let me just put a question. I want to put a question to what you're about to say. So the viewers are clear on what you're talking about.
So you're asking what are the indications?
That is what we are about to talk about. So I'm putting a question to it.
You're asking what are the
indications? What are the signs?
There are quite a number of
indications.
It can be maternal, it can be from the mother.
Like our instruction.
You notice something from the mother and we decide to say, okay, let's bring this baby out. It can be from the baby. We notice from the baby, I want to bring this baby out to make sure mother is fine, baby is fine too. It can be a combined problem, a combined factor.
Right.
That's so that if you don't bring the baby out on time, the baby will no longer be,
so you mean like when a problem is.
So if you want me to be listing, the list is they are quite. They are long, but the list is long. So now, what we should know is once you are evaluated and you are told you need a cesarean section, engage your experts to know why it is. It's not only because the baby cannot pass. At times, we don't want the baby to stay longer so that the baby won't come out. With half of the brain gone. Are you getting? I want to be using terminology that we can relate.
Yes.
Half of the brain gone. Then you say, okay, this girl in child,
hospital,
this boy in 5 years, he cannot read this, he cannot write this. But when you were told in labor that okay, you need cesarean section, you say over my dead body. That I want to do like
in the Hebrew woman.
The Hebrew woman must pass. And you see some people going to the religious home and giving testimony that the doctor has said that I will deliver a cesarean section and God gave it to you and the baby came out. It's not because the baby cannot come out or the baby will necessarily die when the baby comes. In some instances, we want the baby out perfect.
C-section is not even a bad thing.
Okay. So some are exitant not because they think it's a bad thing, but they fear of surgery.
I think it's a lifesaver.
We in our environment we're scared of surgery.
I know.
Once you hear surgery, you think it's.
I know.
Your life is on the line. Yeah, understandable. So, but when you engage your doctor, discussion.
Enlighten you.
You'll be well enlightened and you will know the need. To do that. So, like I said, quite a number of times. What you were asking the other time is when we say cephalopelvic disproportion, when the head of the baby is big And so some of these your MMS, the multi.
IFA.
Yeah, I mean, some of these your multi. I don't want to mention
IFA and MMS.
because in our environment, I discovered that a lot of our women are crazy about a particular brand, and I don't want to mention that.
I know, I don't want to mention too.
This brand has been implicated in actually just making the baby big. And when they are big to a certain extent, you end up requiring a cesarean section. So adding little or not so much value to, when you compare with your IFA, which is iron and folic acid. You understand? And we're talking about different types of micronutrients. The question is, who told you those are very, very essential, even what tests have you done to check if you're deficient in this? Someone say, okay, let's go and take it. Since we can't even test it to know if it's low or high, let's just bombard our system, blind management, fortify ourselves. So when the baby is big, when the baby is not in good shape, when the baby is not healthy, when the environment is no longer
or you're at risk,
conducive for the baby. Are you getting it? When the baby is no longer, and at times for the mother, if the mother is contracting and the the cervix is not responding, and the contraction is so strong that it's just like, how do I explain it now? You are in, how do I explain it to? There is a certain amount of force that need to push you out of this place. They keep pushing the force and the door is not opening. Over time you get tired and the force continues, you lose it. So we have ways of seeing these things. We have way of knowing when it's already telling on the baby. We can even juggle around to know, okay, how long does it take? Because we can time deliveries. How long does it take for this baby to come out? Now, this insult, can this baby bear it for the length of time remaining? No, I think we need to bring this baby out so that we bring a healthy baby, the brain intact, everything intact, we bring the baby out. The baby may still come out if, like in some cases, when the mother refuses, because there's a consent that you must agree. It's not my fault, my force. No, we have to agree. It's a patient-centered care. You must agree with us. Ours is to guide you, to encourage you, to give you the information, then you make an informed decision. So when you refuse to sign some consent, the baby go out, we struggle, we sustain the baby, you can say, hey, you see now, you have not seen. At times you can wait.
They're usually complications.
You can wait up to 18 years before you see the effect of what you did last time. So the list is very long. So we can go on and on. But the most important thing, you can engage. Why do you think that is there? And if it's something that borders on the health of your baby and your own health, I think it's always good to have.
Okay.
At times you go in for cesarean section just because you have had some cesarean section.
Experiences before.
Cesarean section, because once you've had 1, 2, the womb is no longer strong like so going through that tumultuous activity that want to bring the baby out may not be too good for the baby. It can give way, and when it gives way, the 2 lives are at stake. The 2 lives are at stake, so you want to go ahead.
Okay, so during labor, let's do this real quick. During labor, these are myths. I want to believe these are myths, just to lighten the the atmosphere. So during labor, I know our mothers will tell us, after the water break, or maybe before the water break, our mothers have a way of knowing when you're and all of that. Yeah, climb stairs up and down. Is it just to widen the pelvic, or so that the baby can quickly, you don't have to labor for long and all of that. So I have here the climbing of stairs. I have here the stretching. Some people say, so that they are fair. All of that. Are these true?
Well,
they are myths, but
there is no science.
They don't help. Do these help?
I want to go straight to the point.
No.
There's no scientific evidence to support any of those claims.
Okay.
However, is exercise necessary? Not by climbing stairs. It has nothing to do with climbing stairs. And it doesn't have to be when the water has broken. especially, I need to tell you something.
Mm.
We talk about signs and symptoms of labor.
Mm.
Symptoms are the things the woman will see. They will list to you that when you start having contraction that's painful and is regular, then they will tell you when you see
The mucus.
mucus that is either blood stain or not blood stain,
Mm.
or when the water breaks. You see, among all of those signs, or when you start bleeding, among all of them, two of them are quite obvious. So they are things that once you see, you don't do anything, you run to the hospital. One of them is the water break, then the other one is bleeding. Are you getting it? If your water breaks, a lot of things can happen. It's one of those conditions I told you. If it happens, you have 4 to 18 minutes to go get to the hospital. That's not the time to go and be climbing stairs. Yes. That's not the time to go and be stretching at home. You go to the hospital, let the doctor evaluate you, or wherever your culture or wherever the birth attendant is, let them evaluate you and take decision on your case. Because the cord of the baby, the life wire of the baby, can slip out to the and the environment outside the womb is not conducive because it stops all the supplies to the baby. And that one, once it's cut off, that's where the timeline starts counting. So that's what the time you want to go on. So your exercise you can do, even once you get pregnant, you start doing your exercise on your first trimester, second trimester. You just avoid heavy duty,
carrying up everything,
everything, or doing strenuous or high impact exercise. Or that's not the time you want to scuba dive. Or skip. So you don't do all of those things. That can cause trouble for you. Yeah, we see all sorts on social media, online. These are athletes that have been doing all sorts before they got pregnant. Their system is still so used to it, so they are not feeling it. They know how to even get out there themselves. So those are not the ones you will go and check on social media. Instagram and start practicing it. So I think, I don't know if that answers the question.
Yes. I mean, we've had a very lovely evening. I mean, I enjoyed this topic most especially. I mean, it's something that's been lingering in my head for a minute, and I'm glad that we talked about it today. Thank you very much, Dr. Adesanya.
It's always a pleasure.
If you have questions, if you are still in doubt, pregnant women, pregnant wives, I mean, you can talk to Dr. Adesanya. You can drop some comments, share the video, tag a friend, tag a pregnant woman, tag some friends, tag some pregnant women. The address is going to be written on the screen right now. Thank you very much, Dr. Adesanya.
Thank you very much for always putting me on your seat.
Next time on another episode. Thank you very much.
Thank you.